Schizophrenia is a psychological disorder characterized by delusions, hallucinations, disorganized speech, and/or diminished or inappropriate emotional expression. Common symptoms of this disorder include delusions, social isolation, disorganized behavior and speech, the inability to express emotion and enthusiasm, impaired motor coordination, paranoia, hallucinations, and confused thoughts. The causes of this disorder are not completely certain, yet there has been evidence shown that schizophrenia is related to genetics as well as psychological factors. Schizophrenia occurs in 10% of people who have a first-degree relative with the disorder, such as a parent, brother, or sister. If an identical twin has schizophrenia, the co-twins' chances of also being affected are 6 in 10 if they share a placenta, and if they have different placentas, their chances are 1 in 10. In addition, schizophrenia can also be caused by birth complications or stress during pregnancy. There's no sure way to prevent schizophrenia. However, early treatment may help to control symptoms of schizophrenia before serious complications develop. Sticking with the psychotherapy treatment plan, as well as taking medication, can help prevent relapses or worsening of schizophrenia symptoms. The psychotherapy treatments include family support, self-help groups, cognitive behavior therapy, and cognitive enhancement therapy, all of which work to better recognize social cues or triggers and improve their attention, memory, and ability to organize their thoughts for people who have schizophrenia. In addition, people suffering from schizophrenia may also need to take medication. These medications include aripiprazole, clozapine, and haloperidol. People with schizophrenia are linked with brain abnormalities and genetic predispositions. These include an excess of receptors for dopamine, creating the symptoms of hallucinations and paranoia, as well as abnormally low brain activity in the frontal lobes, which are critical for planning, reasoning, and problem solving. In other studies, researchers found the thalamus and amygdala to be vigorously active while hallucinating. Some areas are even enlarged, such as fluid-filled ventricles and a smaller than normal cortex, corpus callosum, and thalamus. Lastly, a mid-pregnancy viral infection can impair fetal brain development. The risk factors for schizophrenia, in addition to family risk factors, include low birth weight, maternal diabetes, older paternal age, and oxygen deprivation during delivery, and also famine may help to increase the risk. Statistics. Approximately 2.5 million people in America are living with schizophrenia, and it occurs equally in both men and women. Schizophrenia can affect anyone, but the typical age of diagnosis is from the late teenage years to the mid-30s. Approximately 7 or 8 individuals out of 1,000 will have schizophrenia in their lifetime. Myth versus fact. Myth. Schizophrenia refers to a split personality or multiple personalities. Fact. Multiple personality disorder is a different and much less common disorder than schizophrenia. People with schizophrenia do not have split personalities, rather they are split off from reality. Myth. People with schizophrenia are dangerous. Fact. Although the delusional thoughts and hallucinations of schizophrenia sometimes leads to violent behavior, most people with schizophrenia are neither violent nor a danger to others. Myth. People with schizophrenia can't be helped. Fact. While long-term treatment may be required, the outlook for schizophrenia is far from hopeless. When treated properly, many people with schizophrenia are able to enjoy fulfilling, productive lives. Early warning signs of schizophrenia include depression or social withdrawal, hostility or extreme reaction to criticism, deterioration of personal hygiene, inability to cry or express joy or inappropriate laughter or crying, oversleeping or insomnia, odd or irrational statements, a drop in performance at school, a depressed mood, a lack of motivation, or substance use. If someone is expressing these common warning signs, it is important to be aware because it may be likely that they have schizophrenia. Resources to get help for schizophrenia patients include joining support groups such as the NAMI, the National Alliance on Mental Illnesses. It provides a hotline and other ways to get help. In addition, the SARDAA, Schizophrenia and Related Disorders Alliance of America, gives support for individuals diagnosed and loved ones, as well as providing advocacy and education on mental illnesses. Some famous people who have schizophrenia are Syd Barrett, the musician and founder of Pink Floyd, Mary Todd Lincoln, Abraham Lincoln's wife, Edward Einstein, Albert Einstein's son. Even movies were created, such as A Beautiful Mind and Snake Pit, to depict the behaviors of people with schizophrenia.